Hi, I'm Rachel A. Cabanban and today I am going to discuss the concept map about diagnosis of the patient Anastasia Stelli, who is diagnosed with primary open-angle glaucoma.
Our eyes are priceless windows to the world, helping us understand, interact with, and enjoy everything around us. But sometimes, our priceless vision can be compromised by a disease like glaucoma, also known as the silent thief of vision, and that is a cause of worry.
Mrs. Anastasia Stelli is a 64 years old who has primary open-angle glaucoma. Glaucoma is a disease that damages your eyes of the ear, which usually happens when fluid builds up in the front part of your eye. The extra fluid increases the pressure in your eye, thus damaging the optic ear. Causes being overage at 60 years old, blurry vision, headaches, pain in her both eyes, increasing in blood pressure, underlying condition like diabetes, and family history. For the manifestation, patient Stelli complains of blurry vision, headaches, pain in her both eyes, and seeing angel halos around lights. For the laboratory findings, it was only mentioned the vital signs of the client were temperature of 37.1 degrees Celsius. For the blood pressure is 170/90, which is considered high. For the cardiac rate is 75, and for the respiratory rate is 24. Surgical intervention. They use three tests in the scenario. First is the tonometer test, wherein it shows an intraocular pressure at 28 mmHg. Here is the video of tonometer test on how was performed or used.
Applanation tonometry should be performed after the anterior segment examination. Place the tonometer in position. Insert the blue filter in the slit beam path. Anesthetize the eyes and instill fluorescein. Then gently move the slit lamp carriage with both hands towards the eye. If the patient withdraws, have them look down and gently lift their eyelid and hold it against the brow. Guide the tonometer and slit lamp carriage with your free hand to almost touch the eye. At this point, have the patient look up at an appropriate target such as your ear as you advance the tonometer prism onto their eye. If the patient is not intimidated by the advancing tonometer tip, you can eliminate holding their upper eyelid. Adjust the pressure of the tonometer prism, cornea contact, with the joystick so that the mires are symmetric. Next, adjust the tonometer's knurled knob to apply the needed force to produce the endpoint. Inner circle touching inner circle. The position of the measuring drum at the side of the tonometer knob records the units of force that are needed to flatten a known area of the cornea. These units are directly converted to millimeters of mercury. The normal range of intraocular pressure is from 10 to 21 millimeters of mercury.
Second is the visual field test, where it appears that patient optic disc is peeled.
Formal visual fields are usually performed by placing the patient's head in a white bowl and having her maintain her gaze straight ahead. Lights of different intensities are projected onto the bowl, and the patient is asked to press a buzzer if she sees the lights. The results of formal static visual field testing are displayed on a data sheet. A series of threshold points tell you how well the patient could see at those points in the visual field. Small dots tell you that the patient could easily detect a dim light at those points in the visual field. Dark squares tell you that the patient could only detect a very bright light at those points. The examiner studies the patterns of the defects in both eyes to determine where in the visual pathway the responsible lesion lies. In this case, The right eye has a temporal hemianopic defect, and the left eye has a nasal hemianopic defect. This is called a right homonymous hemianopia. The lesion lies behind the optic chiasm on the left side of the brain.
And lastly is the laser trabeculoplasty.
Trabeculoplasty is a laser treatment for primary open-angle glaucoma. The laser is used to treat the trabecular meshwork through which the aqueous humor drains. In this procedure, the eye is numbed with eye drops. A special laser lens is placed on the eye to help control the direction of the laser beams. The laser burns a small area in the trabecular meshwork, opening up the drainage canal. About 50 spots over 180 degrees of the meshwork circle are treated in one therapy. The original laser trabeculoplasty procedure applies argon laser of 514 nanometer wavelength on half of the meshwork circle in one treatment. Although a second treatment can be performed on the other half of the circle, the procedure is generally not repeatable as it causes extensive scarring of the trabecular meshwork. The newer technique, selective laser trabeculoplasty, or SLT, uses a solid-state laser of 532 nanometer wavelength. The pulse energy of SLT is about 100 times lower than the traditional argon laser trabeculoplasty. SLT selectively targets pigmented cells while leaving the rest of the trabecular meshwork tissue intact. For this reason, it can be applied to 360 degrees of the meshwork in one treatment and is considered safe to be repeated. In terms of efficiency, the two techniques return similar results in lowering intraocular pressure. Laser trabeculoplasty treatment is effective in about 75% of patients. The effect may take a few weeks to kick in and can last for several years.
For the medical intervention, these are the medication that was prescribed to patient Steli. First is the Satalan eye drops, second is the Cetamide, third is the Timolol, and the diabetic pill which is the Siguo XR. Lastly is the nursing intervention. So what to do? First is taking the vital signs of the patient. Second is administer medication as prescribed by the doctor. Then lastly is explaining the pre-procedure, intra-procedure, and post-procedure of the tonometry test to the client so that she know what to do and inform her on what would be happening.